Good day, ladies and gentlemen. I am Cheng, and I'm the product manager at Intracare. And it's actually a great honor to be standing here today presenting after the great information that Jan presented to us, and also the amazing information from Laurens. Now, Jan mentioned earlier on that we need to save antibiotics for the future. And of course, we need to maintain their efficacy. And Laurens mentioned that what kind of nutritional alternatives there are to be able to reduce antibiotics. And what I'm going to be talking about today is then the alternatives for antibiotics that we at Intracare have in our portfolio. So before I continue with my presentation, please allow me to introduce to you who we are at Intracare. Now, we are mainly a Dutch company in the south of Holland, in Veghel, and we've grown significantly over the years to be a global presence. Generally, we specialize in the production of high-quality, non-antibiotic veterinary medicines, as I mentioned, and alternative, as well as biosecurity products and nutrients, feed supplements, all the while prioritizing unique and practical solutions, such as, for example, our chelated minerals. Now, our chelated minerals are the active ingredients in these non-antibiotic veterinary medicines that I am going to be talking about today. Now, we have Intrahufit gel and Intraepidine. Now, these two medicines are used mainly in dairy cattle for the treatment of digital dermatitis or mortellaro disease. It is a disease affecting the interdigital space of dairy cows. And we also have then intradisulfiram, which is used mainly in swine. And this is for the treatment of a mucohemorrhagic diarrhea caused by swine dysentery or the bacteria Brachyspira hypodysenteriae. Now, interestingly enough, you may notice that these two products are used in different species. However, there is definitely one linking factor between these diseases. They're both caused by spirochetal diseases. Now, spirochetes, these are special shaped bacteria. They are called spirochetes because of their unique spiral shape, as you can see in the slide here. And you may not have heard of digital dermatitis or even swine dysentery, but I'm sure that you've heard of diseases such as syphilis in humans, Lyme disease, and even leptospirosis or Weil's disease. And these diseases are all caused by spirochetal bacteria. Now, these bacteria are actually quite smart bacteria, and they've got a special property in which they can, because of their spiral structure, they can almost have a corkscrew motion to bury themselves deep into either the skin or the intestinal epithelium. This brings me then to the topic, of course, antimicrobial resistance in these specific bacteria. Now, because they're already rather special in terms of their physical capabilities to avoid antibiotic and antimicrobial treatments, the antimicrobial resistance among these bacteria is, of course, a growing concern. Now, not only do they have these specific physical properties, they're also very fastidious bacteria, meaning they're difficult to be cultured, they're difficult to be studied, and therefore, of course, without enough knowledge, then we don't know exactly how effective the treatments that we currently have for them are. However, looking at the human health aspect, of course, we see that one of the most studied spirochetal diseases in human health is Treponema pallidum, the bacteria that causes syphilis. And there are already reports of treatment failures in practice, which are very significantly linked with rising antimicrobial resistance. Now, of course, we're talking then today about the antimicrobial resistance in livestock. And with digital dermatitis, it's not a different story. Now, again, you see here these very large red angry lesions caused by this treponema disease, treponema bacteria in dairy cattle. And at the end of the day, this is something that we do need to ensure that there are effective treatments for. Now, interestingly enough, there is an average of about 20% of digital dermatitis around dairy herds. And from a while ago already, it is quite known that in vitro antibiotic sensitivity testing to the commonly used antibiotics to treat this disease were always kind of in question. In 2016, Plummer found that there was even a 90% treatment failure with a tetracycline rat. So of course, this disease, as you saw, it's not only causing red angry lesions that cause a lot of pain and lameness in dairy cattle, it's of course of economic importance because it causes a reduction in milk yield and of course early culling. The disease is already inherently difficult to treat, and so we need to ensure that we save antibiotics for the worst case scenarios. Now, we've, again, as I mentioned earlier, developed a perfect alternative for that in the form of intraepidina and intrahufit gel. Now, as you can see here projected, you'll notice that with intraepidina, we managed to see a cure rate or an effectivity of either similar or even better than the current topical treatments of using antibiotic sprays for the treatment of digital dermatitis in 7 commercial dairy farms here in the Netherlands. Now we see as well in a trial conducted in collaboration with the Dutch Animal Health Center that Hufit gel was, again, similar in terms of efficacy to antibiotic sprays, or even better, up to 1.5 times actually more effective than an average chlortetracycline spray. And so as a quick summary to my slides on Hufit gel and Epidina, one thing that I'd like to then bring forward is then it begs the question of, were antibiotics really effective actually in the treatment of digital dermatitis? Now, we may not exactly know a 100% answer to that. However, what we do know is that intrahufit gel and intraepidina are clinically proven efficient veterinary medicines for the treatment of this very fastidious and problematic disease. Now I'm going to move on then to the second alternative solution that I mentioned, talking about intradisulfonol for the treatment of swine dysentery. Now, we know that at the moment, the current treatments for swine dysentery have not a lot of future. We see that antibiotics, for example, are being more and more controlled, and of course the zinc oxide ban comes into place, especially here in Europe in 2022, which is next year. It's coming very quickly. We see also that there are significant increasing trends of resistance in Brachyspira dysenteriae. Now, as you'll see here on this slide, that blue line, if you look at focus on tiamelin, that blue line was the resistance trends in 2010 and periods before 2010. And the red line is then the trend in 2010 and 2015, showing you very simply that they need to use more and more antibiotics to be able to kill the Brachyspira dysenteriae bacteria, showing you that the trend is increasing in terms of resistance. Now, what we have in intradisulfonol is, as I mentioned, a non-antibiotic veterinary medicine. Now you'll notice in the top left quadrant in the photo of the agar plate there, the top left quadrant is our product, whereas the bottom left quadrant is a control with ampicillin. And you'll notice that around that disc with ampicillin, there is a significant ring of inhibition, whereas in the top left quadrant with intradesulfonol, there is no zone of inhibition. So it does not work in a bactericidal or a bacteriostatic manner. What intradesulfonol does actually, as you can see once again in this slide, is that it blocks the adhesion of the bacteria onto the intestinal epithelium. Now, Brachyspira, what it does is that it needs to attach to that epithelium via the outer membrane protein. And what intradesulfonol does then is it sits in the receptor on the intestinal epithelial cell to prevent the attachment of that bacteria. And of course, then that bacteria will not be able to proliferate, that bacteria will not be able to multiply, and it will then be flushed out of the system. Now, of course, to see the efficacy of intradesulfonol in the field, we conducted a field study in collaboration with, once again, the Dutch Animal Health Center in 2 commercial farms here in the Netherlands. 58 Brachyspira Hio dysentery positive pigs were tested. One group was treated, the drinking water was treated with intradesulfonol, and the control group was treated with a placebo. The treatment period was conducted for 6 days. Now, on the first day, basically the day of outbreak, the day 0 considered in the clinical trial, we had, of course, typical clinical symptoms of swine dysentery. As you will see in that picture on the right, mucohemorrhagic diarrhea with even flecks of fibrin. On the left, you'll notice a pig that is rather gaunt and emaciated, showing you the weight loss and dehydration that occurs from the diarrhea with swine dysentery. And after 6 days of treatment, this was the clinical picture. You'll notice that on the right, the treatment group with intradesulfonol, the pigs were bright, active, and alert, and had significantly higher body weights than the control group on the left. If you look really, really closely on that picture of the control group, you will still notice that towards the far left, that those pigs are still having some severe diarrhea. Of course, they're huddled together due to the dehydration and the weakness, and of course, low body temperatures. Now, we did not only look at their physical outcome, we of course looked also at their fecal quality, and we assessed the score of the fecal quality. And what you'll notice on the right is that in the 6 days of the treatment period for the treatment group, they have resolved their clinical symptoms almost quite quickly, within 2 or 3 days, whereas in the control group, they continue to have diarrhea even past those 6 days of treatment. And of course, due to welfare reasons, they were given some antibiotics on day 5 and day 6, and only then did the trend of their fecal quality start to improve. Now, we also conducted a qPCR on the presence of the bacteria in the feces of both the treatment and control groups. Now, bringing your focus to then the intradesulfonol group, you will notice that the bacteria is almost not present anymore on day 4, whereas in the control group it was constantly found. And looking then, bringing your focus to the pictures on the left, you will notice that there was also, of course, beautiful histological photos of the lumen of the colon of the pigs with Wharton tarry staining. And in the control picture, you will still see very small little spirochetes in the lumen, whereas in the treatment group, again, no spirochetes, very beautiful intact goblet cells there, showing you that that colon is a healthy and intact colon. Now, in conclusion, for the slides on intradisulfonol, on the clinical trials, you will see here that basically these two clinical trials showed that intradisulfonol is able to flush out the Brachyspira from the intestinal canal, meaning that at the end of the day, the feces is free from Brachyspira. Of course, the most important thing is that the diarrhea is improved, the diarrhea is treated with intradisulfonol, and these pigs then, of course, had higher body weights at the end of the treatment period. So that brings me to the end of my presentation. Now, just as a general conclusion to this all, at the end of the day, there are, of course, there's no silver bullet, as Jens said. There has to be not only management changes, hygiene, so many different things, nutrition as well. But what the message I would like to give here is that there are also perfect alternatives to antibiotics as well, to be able to help in the reduction of antibiotics in the long run. Thank you very much.
Thank you very much, Cheng. Very good presentation. And the audience is answering to our request to ask questions. Here is one. What do you mean by fecal quality? Could you explain that for a bit?
Yes. So the fecal quality was basically given a score, and a good quality feces would then mean a normal, hard, dry feces with its normal form, whereas a bad quality feces would then be given a higher score, and this means then watery, diarrhea feces with either blood or fibrin flecks, and that would then be the general.
I can understand that. One other question is, what if intradisulfonol does not kill Brachyspira, but rather allows it to flush out of the system?
Yes.
Does that mean that the bacteria actually is around, yet the animals don't have a problem with it? Or does it also mean that in the long run, the bacteria disappears?
That's actually a really good question. So yes, what happens is that the bacteria is being flushed out of the system, and basically with general hygiene practices, especially with good cleaning and disinfection, you're actually able to remove that bacteria then from the environment. And so again, there's no one silver bullet for everything. It's not that I'm saying that this is a magic solution. It has to also be combined with a good biosecurity, good hygiene protocols to be able to even to eradicate it actually from the farm.
Yeah, and if I concluded correctly, bacteria cannot get resistant to this approach?
No. So basically, because of the unique mechanism of action of intradisulfonol, because it's only blocking the attachment of the bacteria, and it's not at all targeting the metabolic processes of the bacteria, there is very little ways that the bacteria can actually develop resistance to intradisulfonol. So no, there's no risk of resistance buildup.
Thank you very much. Very clear story.